It's clear that a coordinated international response is essential to stop these outbreaks and save lives.
As cases of Mpox skyrocket in Africa, the World Health Organization has declared its highest level of alarm under international health law. It follows African health officials who declared a continental public health emergency yesterday. Meanwhile, here at home, cases are also on the rise.
So this year alone, we've seen 93 reported cases of Mpox in Toronto compared to just 21 cases for the same period last year.
Ministry of Health guidelines recommend 2 doses of the Mpox vaccine, and Toronto Public Health is urging eligible residents to get their first or second doses as soon as possible. A list of vaccine eligibility criteria is available on the city's website.
People think this is a mild disease, and in the majority of cases it is, but someone will never know if they're going to be the one that ends up quite sick.
At the same time, measles cases are also still on the rise in Ontario. The province reported in May there had been as many cases this year as there have been in the last decade. That's prompting similar calls for vaccinations, especially for children before heading back to school next month.
I would just encourage people to have those conversations with their primary care practitioners to make sure that their vaccines are up to date, including ones that directly impact children and our school system.
Health officials say lower vaccination rates for both measles and Mpox is likely fallout from the pandemic, and it may be causing the diseases to spread more easily.
Disruption of healthcare during the pandemic, people not being able to get to their doctor or get these routine preventative things like vaccines, and also a little bit of this halo effect with all of this misinformation and disinformation about the COVID vaccine, some people having lost faith in vaccines in general.
Experts are assuring the public that both the measles and Mpox vaccines are safe, but say they also understand some of that hesitancy and recommend people talk to their healthcare providers to learn more if they still have questions. Tyler Cheese, CBC News, Toronto.